the do's and don'ts, because it's not like COVID or others. You get it through physical contact with fluids of somebody who is having the virus. And when the virus maybe settles on in your hands, on the skin, then it enters through openings. If your skin is intact, the virus may not enter, but if it has abrasions or injuries, it can enter. Then also through the other body openings, like you may have the virus in your hands. If you touch your mouth, you touch your nose, touch your ears, eyes, sexual organs, like through sex, those are openings which can allow the virus to enter your body, and then it causes damage, like you have explained. This virus has different strains or types, up to 6, but those which cause disease in humans are mainly 3, and they are named according to where they were discovered. Like that we call Ebola Zaire, Ebola Sudan, and Ebola Bundibujo. The current outbreak is caused by that Ebola Bundibujo. It's called Bundibujo because in 2007 and 2008 we had an outbreak in Bundibujo. When they isolated the virus, it was different from the one which had appeared in Congo and appeared in Sudan. There are other strains, but they are non-pathogenic. They don't usually cause illnesses in human beings. And like you have said, the other strains, like the one of Zaire, they have vaccines and drugs. But this Bundibujo doesn't have a vaccine yet and a drug yet. But there are trials which are being done, but they are not yet conclusive. And that's why we must be very careful and follow what health workers and what you are telling the public, so that we avoid and prevent getting this illness, since we don't have a vaccine and a drug yet. But like you have clearly explained, if somebody comes early and is attended to by health workers, you can go through the sickness and you get cured and you are sent home, like the 5 who have been managed under our system, and they have been discharged and they have gone home. The problem is that the symptoms of Ebola disease are like those of malaria and typhoid, and it's important for the public to know. You get fever, headache, nausea and vomiting, joint pains. If you get worse, you can start getting bleeding from different parts of the body. So people out there, someone might fall sick and they think it's malaria. So it is important that if somebody develops any of these symptoms, especially if you have had contact with somebody who is sick or those who live on the borders with the DRC, it's important they go early enough to the health facilities, because the health workers can manage these cases, Your Excellency. The Ministry of Health and the government have mounted a huge response to contain this outbreak, and like we have explained, most of the cases that have tested positive are imported cases, because the epicenter, or where this outbreak started, is in our neighboring country, DRC, in Ituri province. But the other provinces like North Kivu and South Kivu have also registered cases. So we appreciate your guidance that instead of allowing many more Congolese coming into Uganda, we go and work with the Congolese government and the people to establish treatment centers across in areas close to the border, because there is a belief and perception in the DRC that, which is correct, that there is better management of the cases here in Uganda. And that's why many friends and brothers and sisters in Congo try to come to Uganda to get better care. Even the first person who came and died came as a patient, but I think he didn't reveal that he was sick, and was admitted in Kivuli Hospital, managed by health workers. He came on the 10th, died on the 14th. Then on the 15th, that's when the health workers confirmed it was Ebola, but he had come for treatment.
So, like we have guided, we are going to establish the treatment centers, up to 4 centers in the DRC, and we work with the WHO and the health workers in Congo, but also we take our experts to Congo so that the Congolese know that the good services they would be getting here in Uganda can be got from their own country, and then we minimize the numbers which are coming into Uganda, Your Excellency. But we have also mounted a strong campaign, especially in the districts and communities bordering DRC, and give them measures, like we have closed the markets and all these gatherings. We have advised people to avoid weddings and big parties, and the health workers, the RDCs, and the other government workers are seriously mobilizing together with the Ministry of Health staff. Maybe where people are still concentrated, but we have given them guidelines, like in schools, because we didn't want to close schools, but all schools have been given guidelines on infection control measures, like ensuring that the learners can wash their hands, use sanitizers, and all the preventive measures. And also the churches and the prayer gatherings, they have got all the guidelines on what to do to ensure that those who come for prayers remain safe and do not become a vehicle for transmitting the virus, Your Excellency. So we further appeal to Ugandans to be watchful, to be on the lookout, that if we follow these basic measures, we can be able to arrest the transmission and wipe out this outbreak as soon as possible, Your Excellency. Maybe my team can add any more comments.
Your Excellency, you asked in the last outbreak, the total people that were infected was 14, and 2 died before they go to our treatment unit. But all the people we got in our treatment unit were treated and got better and went home.
The 12.
Outbreak.
The 12.
The 12.
Mm.
And in West Africa, Your Excellency, those who died were 11,000 people who died in 2015 in West Africa.
Mm.
At the moment, we have discharged 5, but all our patients that have been in ETU, the ones that have been treated, are getting better. The ones that were really, really sick, they are getting better, and soon we will also discharge. We don't anticipate anyone to die in our ETU. All the people we got this time who have been treated in our isolation center. But Excellency, I wanted also to add something that we are seeing of great interest that is going to add also the knowledge, global knowledge on Ebola. We have seen that when people start getting symptoms, the virus is highly concentrated in the saliva, in the vomiter, and in the stool. It is high concentration. It is much more concentrated in the
Alimentary canal.
intestinal system, more than even in the blood. Even the people who are clearing the virus, now we are changing our protocol because we don't go by only the blood, that when the blood is cleared of the virus, we let go. Even for women, for men we know that the semen keep the virus for a longer period. Some have gone to, as you said, up to 9 months. For women, we were very interested. We want also to check to know whether also in their fluid that virus stays for long. But what is very clear now is that even when people clear in the blood, the virus takes a little longer to clear in the saliva and in the stool and in the vomiters. So people even can clear, can get better, but when they are still shedding some virus, meaning that the alimentary canal is a very fertile ground for the virus to multiply, and really it's like a safe haven. I think that there is no strong defense in the alimentary canal that fights it, but also that's why it multiplies very, very fast. So we are saying, number one, that even when somebody has symptom of fever, do not share a cup. Do not drink on a bottle someone has drunk. Do not share a cup. Number two, for people who are in the villages during mango times and all these fruits season, do not eat on any fruit that you have found that is bitten or it has some broken part, because you do not know what animal could have eaten that fruit. Number three, right now we do not encourage in church to use a cup for Holy Communion, because that is a big recipe for infection spread, not just Ebola, but even other infections like hepatitis B. It's highly infectious in saliva, so you can infect. So as we are educating the public, we are also gathering more evidence that will help us to refine our protocols on treatment, on prevention, and also on how we are going to continue engage the public on the prevention. Thank you, Excellency.
Your Excellency, thank you.
That is the commander of diseases. Is the Commander General.
No, Your Excellency, I'm now also converted more prevention.
Oh,
yes.
It's now Director General of Health Services.
Yes, please.
You want us to remain healthy rather than disease.
Yes, please. Your Excellency, as you clearly indicated, the people at risk are really the health workers. Because the 5 cases which we got, 4 of them are health workers. And then the other one was the driver who transported the first case. And
Our health workers of Uganda.
of Uganda, yes.
Who handled the Congolese carelessly?
They handled the Congolese because this particular patient, I think they got into the process. She was very sick, and then she got into a cardiac arrest, so she got into a process of resuscitating the what? So the exposure was very, very huge. Because also we are seeing that others might be exposed, but they are not seroconverting, they are not getting the disease. So this particular group, because it's actually in one hospital, that's in Kampala Hospital, all the 4 happen to be what? In that place.
So how are they trying to resuscitate?
I think definitely you do a cardiac what? And trying to put a tube in the what? In the CPR.
Without gloves?
They probably had gloves, because at that time, that particular patient had now in the terminal stage of dying, and she was having signs of bleeding. Because that's what we are also seeing, that normally as they are dying, actually when the person is dying, the virus also does not want to die with the dying person. So it gets into the surface of the what? Of the body. And so all the body is very infectious. That's why the bodies are really super spreaders. Like you remember when we had in Kasanda, where a group which went and exhumed a dead body, and then they had a very big exposure. So really our call is to the health workers that they need to protect themselves, put on gloves, sanitize and wash hands. Those are really preventive mechanisms, can protect them, protect their patients, but also protect their families.
But in this case, where was the carelessness?
The carelessness now, because now I am sure that the patient there was a lot of bleeding and probably a lot of probably vomiting, a lot of fluid coming through the throat, and even when they were trying to put the endotracheal tube, there was already bleeding which was coming out. So in the process, the gloves sometimes...
But how could they have done it safely?
Now
to put on the gown?
In that kind of patient now, they needed to have put in what we call now, it would have needed to put in an Ebola suit, where they should have been able to have goggles. Because like when you spoke about the late Mercy Lukuya, the exposure he had is that the patient was agitated because of restless, because he was about to die. So in the process, a lot of either he coughed, then it got into his what? Into his face. So that's how he got contamination. So it gave him a lot of high-risk exposure.
Okay, so Ugandans and other friends, this what we wanted to share with you. Have we had any new cases in the last?
No, in the last 5 days, we've not registered any additional cases.
Please, you can see this is a very simple thing. A few people came from Congo. A total of how many now, including the ones who died are all Congolese? The two. So that means that 16 Congolese came and
the 14 included the two who died.
So the total are 14.
Oh, 14, okay.
The two died, 12 are the ones that we've been treating.
So you people, Uganda, you can see now, this is just simple mismanagement of something that can be managed. 14 people from Congo came. The two who came late died. The 12 who came early, 5 have already recovered. All the 5 are Congolese.
One is a Ugandan, the driver.
Okay.
Then the 4 are Congolese.
So out of the 12, Congolese, 4 have recovered. The Ugandans are 5, so 1 has recovered now. That means the ones who are still sick are 4. And they are all health workers. So the story is clear. Some sick people from Congo came, they were not handled carefully here. That's all. Now with the little alertness we have had, although me I'm not satisfied because I was at Kororo and I was watching those MPs dying to hug one another, and it is as if they are bewitched. Bani babaloze o baba batia. Wamelogwa au wako namna gani? In spite of all that, 5 days now, no new case. It looks as if the fire of Ebola has started going down. So therefore, please, we've got a lot of work to do. Let's be very serious. We don't have to keep playing around with it. Listen carefully and act. This is easy to stop. We stopped it in the past, we can stop it now. Thank you so much. God be with you.